Hey everyone, my name is Lavonne and welcome back to my YouTube channel. One of the recommendations that I make to all of my personal clients and that I'm going to be making to you is to perform and use breast massage for your breastfeeding journey. And so today I'm gonna talk to you all about what that is, how to do it, and then why it might be helpful for you if you are choosing to breastfeed. But before I do that, make sure you subscribe down below, give it a like, share it with a friend, and then let's get massaging our breasts. I wanna know in the comment box down below if you were ever told, whether you have been breastfeeding before, you've had a baby, or you're leading up to and anticipating your breastfeeding journeys, if you've been told about breast massage, because I feel like this is one of these like very underrated, very not enough used easy techniques to help with your lactation. So one of the things that breast massage does, and I'm gonna teach you how to do it in a second, but when you massage your breasts prior to breastfeeding, whether that be pumping or putting your baby on the breast, it can help increase circulation. And anytime you're producing milk, we want that circulation, we want blood flow to help with your flow, to help with engorgement once your milk volume changes after you've been feeding for a few days. By the way, you have milk from the very beginning, you just don't have a lot of volume. And so eventually when you've been removing milk, your breast volume changes pretty quickly. It can happen within a couple of hours, over like a moment. You wake up in the moment, you're like, whoa, my boobs gained a whole cup size and they're rock solid and uncomfortable. That's normal. That's the normal process of milk production, and it's called engorgement. What can happen with that is that can lead to clogged milk ducts, that can lead to mastitis, which if you want videos on those, they're in my queue. But ultimately what we want is we want to remove all of the milk. You're not going to remove all of the milk, but we want to remove the most amount of milk possible, because for a few reasons. One, the more milk we remove, the more that tells our brain, this is how much milk you need to produce so that you continue to either increase or maintain your milk supply. All right, so I have a video already on ways to increase your milk supply that you should check out. If you're struggling with milk production, that's gonna be number one type video that I'm gonna send you to as a resource to you. But in addition to the things that I mentioned in that video, breast massage can be very helpful to help increase your milk production. And then also either prevent or treat any kind of clogged milk ducts. How do you know if you have a clogged milk duct? Would be you have like a hard, firm, round ball in your boob. This is only for breastfeeding. If you have a round ball in your boob and you're not breastfeeding, like that needs to be checked out by your provider. But if you have like sort of a painful, uncomfortable area, that is called a clogged milk duct. You think about like milk that curdles. It's true. If milk sits there for a really long time and it isn't in this like river of flowing out of you constantly, it sits and it coagulates and it gets like thicker and it can clog, and that can be really uncomfortable. That can actually lead to complication of mastitis or infection. So what breast massage does is it helps loosen up any of that stagnant milk, particularly in the back part of the breast, to help bring it forward and help with that flow of milk to remove and increase your milk production, and then to help prevent complications. So then the question is, how do we do breast massage? The first step is you need your hands, and then you need access to your breast. You can do this over your clothes. You can also do this naked. You don't, to me, really need any kind of lubrication depending on what you're using. If you're, let's say you get out of the shower and you just wanna do a little like wakey, you can, especially if you have a clogged milk duct. We definitely wanna be massaging that out. But this is more towards the beginning of breastfeeding. So when you're anticipating bringing the baby to the breast, or especially if you're about to pump, I don't ever work with a mom and not have them do breast massage for about 5 minutes prior to pumping. It's just gonna help with getting more milk and then also with loosening up the back parts of the milk. Fun fact, so you have foremilk and hind milk. Okay, so if we look at our breast here, the foremilk, you imagine like all of the milk sits in this breast, right? The foremilk is at the front part of the breast. That has different nutrients than the hind milk. The hind milk has more fat density in it. So we want to grab that fat to help, we want to bulk up our babies, right? We want them to have fat to use for energy and for nutrition. It's good fats, right? So what we do is if you only remove the front part of the milk, we never get to the hind milk. So the idea is by massaging it, we're literally pushing that hind milk forward to help them get more nutrition, to get more actual milk. And then obviously when we remove milk, we increase milk. I've already said this. You get the idea. Okay. So before you breastfeed, before you pump, we want to wake them up. Okay, so what I usually do is literally take your fingers, and you can do this on yourself to practice, and just say like, wakey, wakey, boob, you're gonna do such a good job. We're gonna just kind of almost tickle them. Some people might just do like a gentle, like stroking action where we're saying, wake up, you're about to do your job. Now you have work to do. So we're gonna wake them up for 30 seconds to a minute. Then there's lots of different ways to do breast massage. There's really no right or wrong way. I'm gonna show you a few and the ones that I probably use most, but if you find another technique that works better for you, that feels good, please do that, okay? There's no right or wrong way, flex and flow on this one. But in general, I'm probably going to use the pads of my fingers, and I'm gonna start from the chest wall. How do you know you're at your chest wall? I can feel on my body, my rib, up here on the top of my boob. Okay, so you can feel for bone and something firm behind your tissue. And then if you stroke down, it starts to get a little more smushy. You're into the breast tissue there, okay? So I wanna start from the chest wall, so at the base of the boob. If this was like, say on me, it would be starting here. This is where like my boob touches my chest wall. I'd start all the way back here to push forward. So I'm gonna take my palm and push towards the nipple from all directions, okay? And this is pretty firm pressure. It should never be painful, but it's enough that you're like actually moving things forward versus like a gentle wakey, wakey. That's more the wakey, wakey. And then we wanna get from massage, where it's actually moving around the milk and kind of loosening up the milk. I think about, as the nurse in me thinks about like clogged arteries, right? Like if you have like some sort of flow, or like your pipes in your house, which I know nothing about plumbing, so like I'm just sort of assuming here, but like there's gunk that gets on the inside of your pipes. But if there's that constant flow and you're loosening it up, you want that into circulation. You want that out of your pipes so that they're nice and clean. So what you're doing is you're loosening up the pipes in your boobs and your milk ducts to help that milk come forward. So I'm going palm forward in all directions towards the nipple. You can also use the pads of your fingers to do a circular motion around the breast, okay? That's also going to stimulate the milk supply. It's gonna help loosen them up, help get that milk, that let down reflex ready to go. You might even start leaking a little bit, totally fine. And if you do, honestly, you're probably good to go. You can get your baby on or put your pump on and get going. But we're waking them up, we're massaging in circular motions all the way around the breast. The other thing is you want to actually massage the entire breast. It's easy to sort of like, I see this a lot with breastfeeding mamas where they'll like just kind of be pushing on the outside because it's an easy access for a breast massage. This is a little bit more awkward to go from this side. So you have to be intentional that you're actually addressing all areas of the breast, because you have milk ducts in all of those areas. And if I'm loosening it up on this side, there may be some stagnant milk on the other side that needs to be woken up and pushed out towards the nipple. The other thing you can do, let's say you start leaking, you put your pump on or you put your baby on, you can continue to massage from the chest forward towards the nipple in order to help release some of that milk while there's that sucking motion. So it's sort of two different sides of it, right? That you're breast massaging to prepare the breast, to help increase your milk production, to loosen everything up. And then once the milk's being removed, it's like this helps with that flow to grab the milk from the back part of the breast towards the nipples. So that helps your baby remove the milk a little bit easier. It may make your feeds go a little bit faster. Now, mind you, if you're like spraying your baby's milk and they're choking on the milk, that might be too fast of a flow. But this is where it's sort of that art of breastfeeding where you're feeling out. Do I have milk supply issues? Do I feel like I don't have enough? Is my baby on the breast for forever? Add a little massage in as they're feeding to help remove the milk. Up until this point, I've really only talked about pre-breastfeeding or pumping or during breastfeeding or pumping. But the other tip I have for you for breast massage is if you are engorged, if you are feeling like your boobs are gonna explode, they are so uncomfortable, you maybe have the clogged milk ducts, you need a letdown, maybe you're away from your baby, you have plenty of milk stored elsewhere, that for you to massage and release some of that milk, you could put a haka on the breast. You sort of need to be careful around the haka when you're massaging because it might fall off. But you can also get in the shower. This is one of my biggest tips with the heat added and then the release and the calming, like you're like, oh, I feel so like nice and calm in the shower. With a massage can help relieve some of that pressure if you're feeling engorged. And that is the recommendation. If you're feeling like your breasts are so full, you've fed, you have plenty of milk, you don't mind losing some of the milk and you just need that release, then go into the shower and you can do some of this breast massage, hand stimulate or do like a manual expression, which I have a video on that as well, to release just enough until you get some relief from the fullness of your breast. It's almost like I like to compare it to your bladder. You know, when you're like, I'm gonna pee my pants, oh my God, it is so painful. And then if you were to pee a little bit, usually if you're gonna go to the bathroom, you're gonna pee the whole bit. But if you were to get some relief where your bladder isn't quite so full, that's what we want to do with your breasts so that they're not sitting so full, they end up rock solid, and then that can lead to complications. So get in the shower, massage your breasts in there, manually express so you get some relief. The other thing is if you're trying to like wake it up, get the milk out, is you can add some heat to the situation. So prior to your breast massage, you can put on a heating pad, just the electric ones. I know there's ones you can put in the microwave. I know like about a bunch of our breastfeeding brands have heating pads for your breasts that are more like round that you can put on the breast. That's prep for your massage. You think about like if I was getting an actual massage or I'm going to the spa, they want me to be in the sauna, they want me to get in the hot tub for a few minutes prior because it softens everything out and then helps with that flow. So heat is another huge tip I have for you for that breast massage to help increase your milk production and help with the flow so that you can get the most amount of nutrients either saved or given to your baby, and then also not decrease your milk supply and not risk having any kind of breastfeeding complications. Thanks everyone for being here. If you want more from me, check out the description box down below. That has all of my childbirth classes, everything else that I offer, other resources over on Instagram. Make sure you follow me over there. Let me know if you used breast massage, and if you haven't, try it and let me know your experience down below. We can all learn from each other and follow up. That also helps me connect with you to know, is it actually helping you? Because in my experience, this can be a very effective technique to add to your sort of breastfeeding process as you're learning and growing as being a breastfeeding mama. Make sure you subscribe down below, share it with any of your breastfeeding groups, your support groups, whoever you're in contact with. I hope you have a tribe for breastfeeding because breastfeeding can be a journey. It can be very challenging, but also very rewarding, and you need that support to continue to do it if that's your preference. And then until next time, don't forget to flex and flow, and I will see you soon. Bye. We're rubbing our boobies here. I want to know not in the description. You can't touch the description. The other tip I have for you is for those, so pre-breast, make sure you subscribe down below, massage your boobs. Thanks everyone. Now I'm like in my head about it. Thanks everyone for being here and watching. Bye.
Yes, that was good.
Thanks. I switched it up.
That was good. You switched it up.
Okay.
Okay, cut.